time for some questions. There are microphones around the floor. I'll open it up to the floor for questions first, although we have some questions up here. Would you please identify yourself, too, when you ask the question? Thank you.
Hi, I'm Andrea Powell from CABI. I was very struck by that last comment from Dr. Cherney there about the gap between research and practice. And I'm just wondering if you've seen any examples of how publishers have been able to help to bridge that gap by providing better products that take research content and convert it into a way that makes more use for practitioners.
Well, I edited a clinical journal for 15 years, fertility and sterility, and of course, this when I briefed the new people and when I talked about the journal every year, a very critical piece of the journal was to support young people, support their research. Number one, young people have the best ideas, and also that's how people get promoted. So yes, journals have a tremendous impact on how in encouraging young people. If journals become too haughty and only want and concentrate only on their impact factor and only want senior authors, I think that hurts the field and it turns people off. Because if clinicians can't be promoted, it's one thing that you have to see patients 4 days out of 5. But if you're dedicated to research, yes, you can work that one day, and you can come in Saturdays and Sundays. Yes, it involves a tremendous amount of sacrifice. But if you're not being able to get your work published, I think that does have a very negative impact on people. So I think the publishing industry, and Len was my publisher. I don't know if it was possessive of mine, but a publisher to work with me, and he was great because he understood that as well. So I think that's an important point. Yes, the publishing industry, and it's mutual. I mean, you publish our stuff, we give you more stuff, better journals.
And I think if I could add from a different perspective, making sure that the providers in the trenches see the results of the research is important. So thinking of the primary care providers, I've noticed myself in the formats that you're now offering online that it becomes quite easy to access the important information from an article. And so, for example, I get the New England Journal on my iPad and I can see the contents immediately and know what I want to go to and pull it up right there. I don't have to go to some other place to look for it. So anything you can do to make content more interactive in that way, I think, is important in conveying messages succinctly to the primary care providers so they can translate the results of the research into their clinical practice.
And it's from journals that the science writers get their information from. So that's too. They're our best PR people are the lay press in order to support us. People are excited about the research that we do because of what they read in the paper, not what they read in the journals. But it's important that the journals are vital, are vibrant, so that information gets out there.
Actually, to speak about that, when when research gets mentioned in the press, you should always cite your source, JAMA, volumes, whatever, year, date, year, page, and all that. That way, if you are a researcher and you are reading, or even just a frontline clinician, and you read about a research study, you can actually get to it. And that also brings me to one other point. As a assistant and a user to users, if the simpler we can make that click, click, and not click, 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 and then hunt for the volume in the issue, streamline that, you would make a lot of librarians happy to do that.
I actually give my informationist clips from the paper, and she always finds the reference for me.
That's right.
So that's a very good idea.
Everyone could use a good librarian and a little therapy.
Not librarian, informationist.
Well, I'm an informationista.
Another question there. I have actually a question for the panel based on just what you were all saying here. There's a couple of things that came out in everybody's talk about the levels of funding, particularly around medicine. Now, if the U.S. actually still does have, this is a two-part question for the panel, the largest spend on biomedical research in the world. Is that enough, or is that not enough, given what Alan said about the number of researchers? Are there too many researchers, or is the research funding not enough? That's, that part of the question.
Well, the first thing is that gap ever going to be, I don't think that gap is ever going to be fixed, the number of researchers and funding, because funding is not going to go up that dramatically. You could see, the difference is 4 or 5-fold, so that's not going to happen. And we're training too many PhDs.
But should it happen?
Well, no, because it's yes. We don't. If you have utopia, of course, but we don't have utopia. You have to be practical, and there are other things that that federal money has to go to. But the big question is, will other countries, like you showed China, will they surpass us in research? And another big problem with not enough money is we're a very strong country because of the brain drain, people coming here to study, and then they go back to their own countries or they immigrate here. That's drying up as far as us being a source of a brain drain because we don't have enough money to support these people.
I'll just jump in on that. Just from my talks with people in the field and people at NIH, I think you hit it on the head. Well, what's happening is because other countries are increasing the amount they're spending on R&D, and we are either stagnant or decreasing it, we're still spending more than anyone else, but there's a weird dynamic at place, which is that older researchers tend to have more success in getting grants. And so they'll be the ones who stay in America and get their work funded and take advantage of the bigger pool of money that we have here. Whereas developing countries who are devoting more money to R&D are more likely to take the younger researchers who've come to America to study and have a natural inclination to go back home and do their research there. And so we're not going to see necessarily the effects of a stagnant budget in the next 5, 10, 15, 20 years, but 30 years down the road, when a generation of researchers in China, for instance, just to name one country, have been there for 20 years and are making their discoveries there, you could see a profound effect there. I still think U.S. vastly outpaces anyone else in terms of the money it spends, but the consequences of them are definitely profound and a little bit subtle right now, I would say.
One other phenomenon that I think is going to play into how all this pans out over time is that there's an increasing awareness in terms of funding research, that we have evidence that tells us in many areas in medicine what we need to do, how to use the medications, but we haven't had the ability to translate that and to make it, scale it up and make it generalizable so that people actually do it. And so some of the funding sources are moving more now into this area that's called health services research, and one example is the Patient-Centered Outcomes Research Institute. That's a completely new independent organization that funds research projects, but they have to focus on the patient. They have to include the patient in the designs of the studies, and so that takes a different kind of researcher to implement, and so there's some shift in that direction.
Well, let's talk about that for a minute. So what do you think? What do you think about that? Because it's taking money and providing patient care away from basic research. So nothing good. Patient care is good, and I take care of patients. It's okay, but nothing advanced is going to come out of that kind of research. That's going to be a better way to distribute. We have a big PCORI effort on fibroids, so it's going to find better ways to treat fibroids. But the real better ways to treat fibroids are going to come from the laboratory. So by shifting the money into PCORI is good PR for the government, but it's not where the real success is.
Yeah, and I think it's probably an example of the pendulum swings in one direction, and at some point it has to come back into the midpoint. You cannot make big advances without basic science, without the rigorous evidence-based studies, but you do need to be able to take that information and translate it into the population.
And of course, we're going into an area of chaos because of Obamacare. This is going to be chaotic for a couple of years until people figure out the system.
Dr. Altman?
When my first job when I went to the Boston VA, I was with the Health Services Research and Development section of VA research. And I worked for two groups, one to do systematic reviews of the evidence, and the other was the dissemination of information. And our goal in dissemination of research results was to shorten that diffusion of innovation curve, which had been something like 25 years. If you look at streptokinase, was first found to be a viable treatment 25 years before it became the standard treatment in emergency rooms today. So our goal was to shorten that curve with our VA practitioners. VA is the largest healthcare system in the United States, and just to say, our administrative costs are less than 5% of our enormous budget, but we want to make healthcare better for our veterans, and there are certain problems that are like diabetes that are constantly occurring in our Vietnam generation vets now, and they have COPD, they have certain things that are just predominate, and one of those things is getting them to participate in their treatment and to lose weight, stop smoking, manage their health better. And so we spend a lot of money on researching patient-focused care and trying to get them to participate instead of just telling them what to do. We're very focused on that, and there is this tension between basic research at the mitochondrial level as well as ensuring that our patients have the best care anywhere.
Just to follow up on that, do you think, and this is a question for the panel again, but actually start with you on the answer here, because you say that you're not a scientist.
I'm not.
But you have actually reported so much on the effects of the sequestration on research funding. Do you think the American public, or that the public in general, has an awareness of the importance of research funding? No, there's a tremendous amount about science and an lack of appreciation for science, and the social media now has the "I love effing science" campaign kind of thing in an effort to raise the awareness and the profile, but about research funding rather than specific disease funding, the importance of research funding.
So, I haven't seen any polling data on it, which would be the best way to answer the question. I could give you an anecdotal response. When I was researching my long-form piece on sequestration's effects on the NIH, sorry, I pulled this a little closer, I went down to the University of Virginia to talk to a scientist there who had scored, I think, in the top 2% of funding when he submitted his grant the first time, and then for his renewal was at something like 18 and had not gotten funds. And he was really upset. He had put in about 5 years of research, thought he was on the cusp of a major breakthrough, and really felt strongly that he deserved the funds, but for another reason entirely, because he had so many people in his own lab and outside of the lab, providers of the equipment, for instance, who were dependent on the funds as well. And the university itself, who was dependent on the funds because if he didn't get funds from the NIH, they would have to try to figure out a way to step in to fulfill the hole. And so the point of this is that there's a trickle down. The NIH, $1 spent by the NIH, I'm assuming has a massive trickle down effect to the community that receives that funding. And the reason I bring up this guy is because the congressman who represents Charlottesville is a conservative Republican who voted for and championed sequestration, but was, resolutely committed to this man that he would fight for the NIH funds for that university, because the University of Virginia had something like $300 million worth of funds, I think he said, that was tied to the NIH. So I do believe that the public recognizes the importance of research funding and the value that it has for the society. If you assume that members of Congress are, if you have the very maybe skeptical assumption that members of Congress are there strictly to represent the popular opinions of their constituencies, you would have to assume that people really love the NIH, because I've yet to find a member of Congress who doesn't want to fund the NIH. It just so happens that they've cut it. So I would answer your question, yes, I do understand. I do believe the public gets it, and it's really because it's really hard not to get it.
I mean, that's your only hope to live forever, is the NIH and basic research.
More or less.
So that's everybody,
How could you be against it?
That's right. I think people are well aware of basic research and its importance, because patients now, when they come in to see you, they want to know why and what can. I must get a call a day from people to say, "What do you do at the NIH? Somebody has myeloproliferative disease. What are you doing there?" Because I told them that it's a fatal diagnosis. Can't you cure it?
I just want to add another story before. I'm sorry to dominate the mic here, but what I've noticed, and when I do this reporting, is that people know people who are affected by the cuts. I wrote a story on the Charlottesville story, the big piece. I had someone email me being like, my cousin is out in Kansas and was supposed to be a scientist, but she got a cut. She got her grant cut, and he gave me the cousin's email address. I reached out and I talked to this woman, and she had studied at a major university, had done 8 years of academia. Her grant was cut. She could not find another job and ended up working as a secretary at an automotive parts manufacturer because there's just no future for her in science. And everyone knew that her future had been in science, but it had been taken away from her because of the cuts by the federal government. So these stories get around, and they're passed among peers, and people recognize that we're sort of at a precipice here.
We're just about out of time here. Then I actually would like to thank the panel, although I do feel there's some cognitive dissonance, because if all of the Congress really are in favor of the funding and they're all saying yes, and the funding can increase, then there doesn't seem to be a problem. But we all know that very well that there is a big problem. But it's been wonderfully engaging to have you all here. Thank you very much for your presentations and for talking with us. Thank you all out there for being here, for filling out those forms, for tweeting when you can. Adipon is going to have us outside now for a very nice reception, and we all look forward to seeing you back here tomorrow. So thanks again, and thanks to STM.
Thank you.
Thanks. It was really good. I really appreciate it.